Good evening, friends. Today onwards, I'm gonna do some of the podcast with the renowned psychologists of our India. So initially, this thought came into my mind that we need to collaborate. We need to collaborate with the rest of the Indian psychologists in order to spread the awareness towards psychology. And there are so many stereotypes and prejudices are there in society. So, with the help of senior psychologists and enthusiasts, students as well, so we're gonna make sure that these stereotypes are gone away. So, I just want to introduce Manoja ma'am, who is very renowned and senior psychologist of our India. So, ma'am, just can you introduce yourself first?
Yes. Thank you for including me in this session. And I am Manoja Jacob. I'm a clinical psychologist and I'm practicing right now in Bhubaneswar. I started my career uh, in the year 1992 as a psychologist, as a researcher. It was a project in CMC Vellore. Uh, it was on psychological impact of HIV/AIDS, uh, and then I went on to do my clinical psychology. I studied from Central Institute of Psychiatry, Ranchi, 93-95 batch, and then I worked as a lecturer in clinical psychology in CMC Vellore. From there, I moved on to NIMHANS. I worked as a clinical psychologist there. And then I moved on to Kerala State Government Health Services. I was working with the government of Kerala in mental health services. Since 2003, I'm here in Bhubaneswar. And as an independent practitioner, I'm having my private practice, and I'm also associated with Infosys as a wellness coach, and I'm also a trainer for diploma in guidance and counseling in Regional Institute of Education, Bhubaneswar.
As a follow-up question, ma'am, in your introduction, you have said that earlier days you used to work with the HIV/AIDS patients,
Yes.
and you were a big part of that awareness or survey campaign. So, can you elaborate
Yes.
more on that?
Yes. Uh, we were actually studying the psychosocial impact on psychiatric patients who were coming, uh, whoever was referred, uh, you know. So what we saw at that was early, very early stage in 92. We did not have
Hmm.
much awareness in HIV, regarding HIV and AIDS and all that. So we were assessing the mental health aspects of psychosocial impact. We found that a major number of clients or subjects who came for the study, they were affected with depression and affected with stigma related to HIV/AIDS, and then more men were found to have at those days HIV positive, and those days it was found in our study at that particular point of time. We found that people from lower socioeconomic status were affected more. More cases were seen among lorry drivers, people, keep traveling from home or longer duration. That some of the findings that is coming to my mind. I'm not able to recall everything. This was done many years back.
And still, it seems like I want to share one another add up information. Still, it seems
Yes.
like there is a big stigma attached to the sexual transmitted diseases and especially HIV. And people tend to not to talk about this. In my childhood, I used to watch all these ads related to the prevention of HIV, and they used to have these big campaigns, and we used to see the billboards, and celebrities used to come to the TVs and channels, even in radio channels also they used to speak about this stuff. But nowadays, this young generation, they are not at all aware of uh, this big thing that is white elephant that is there in our
Yes.
society, but nobody is addressing that, and everybody is keeping quiet, and that even India is ranking high in the HIV cases
Yes.
also. What do you see? Why society has shunned about campaigning and all that stuff?
See, now it has become too common a thing that everybody
Uh,
assumes that, like everybody is aware of it, which is not the truth. So
yes,
kind of, and uh, as a psychologist, so much of funding and so many projects comes up. That is when, we become suddenly aware, and once that subsides, then not much is spoken about that. And now, not only that, so many other issues have come up, and especially for the past 2 years, uh, pandemic, COVID pandemic, and all those
yes,
things.
yes,
And even
yes,
even before that, our mind is shifting from uh, one issue to another, which is good in a way. But then this is an issue that we are still facing. We cannot pretend as though it's not there anymore. And
mm,
I believe the awareness creation needs to start from school, right from school itself. As things are changing, the sexual awareness, in fact, not in a right way, but the sexual awareness, and things are just right there. Media is in your hand, right there at your door, so you can just access it. But somehow, the importance given for awareness regarding HIV, AIDS, and sexually transmitted disorders and all have just faded into thin air. We psychologists need to own up, and we need to create awareness among the youth. Youth are the ones who really need that kind of an awareness, uh, because the social system itself has changed, right? Over the
yes.
Now it's more, relationships have changed. There are so many new things. LGBT community is promoted and has come forward. So the chance of sexually transmitted disease to take over is very high. The risk is very high. It is at stake.
So why I am very touchy about this subject, because so it
Yes.
occurred to me when I'm in 2017 or 18, I was working as a school counselor for social welfare schools, and I was traveling from one zilla to another zilla to address, especially this somebody hired me from the social welfare school, and so at last 2 months when they have these annual examinations, then only they comes to their mind that okay, we need to have a psychologist to counsel these people now.
Yes.
So I have been to some of the schools,
Yes.
and as part of my job, I have been to a particular school, and the particular school's principal was also, the son was also present at that moment, and he came to me and said that he revealed some one topic that uh, so I'm in relation that girl, that boy is just only
Yes.
10th standard student. So I'm in relationship with one girl, and we are having this physical relationship, and she's comes from very orthodox particular community, and so I haven't used any protection, all that stuff he shared. So I was concerned about that boy's life. Okay, what if she was infected? What if he was infected?
Okay.
What's going to happen to that
Yes.
girl's life? And so I was
Yes.
worried. I was worried for one day. Like I couldn't comprehend that these kids they doesn't know uh, safety and security of their lives and all that stuff. That kicked me
Yes.
like in punched in my stomach. So I shared some knowledge with that kid, but but still uh, I was reminded by your topic. Okay, ma'am. Let's get back to the our interview. What do you think are the some of the unique challenges that female psychologists are facing, especially because we see this every woman faces harassment in their work atmosphere, especially if she is in a service area, nursing area, or any sort of caring. So hospitality industry is renowned for bad treatment for women. Okay, let's leave that. But when it comes to the medical services, even medical services, the movies and serials, how they portray women they show it in a bad light. They show it in a very
Yes.
demeaning manner. So what do you want to say about this stuff as a female? You are working in a healing industry, you are working in a caring industry, and you are trying to help with these people, but sometimes you might also encounter some negative aspects of the clients, no?
Yes. Um, Unfortunately, I have not come across so much of discrimination in our country, uh, being in this mental health services. Uh, One reason could be that in the initial part of my work, I was associated to an organization. So I have covering and protection. But I would say once I started my private practice, initially I started in Kerala and then moved to Orissa. Um, Not that I was discriminated much, but there are areas, for example, salary, payment, and, and the inclusion of women in research, academia. In the junior level, it's okay, fine. As you grow up in the ladder in this profession, I have also sensed that when it comes to uh, being in certain posts, you know privileges are given to men, and we women are not given those privileges which are given to men. I believe that is discrimination, to a man and a woman, both of them having same qualification and same similar experiences, yet they are discriminated. That kind of discrimination is definitely there. And even male clients who would want to come to a female psychologist, not um, not many would want to come to a female psychologist, men. Usually I'm talking about men. So the maximum number of clientels I would have are women and young adults, and I have seen over a period of time there is a transformation that's definitely evolving, and things are getting better than before. And especially in the field of psychology, if we see, there is a dominance of you know women psychologists in the field of psychology, uh, and more number of women are coming into this field. Yes. uh, if you would ask me why is it so, women, generally people, of course, women by nature has created us with more compassion and empathy than men. I'm not biased in saying that. That's how we are. We
That's the
are
truth
more
also.
emotional beings.
That's the
Yes.
truth also.
Hmm. Yes. So, this is where, so much of empathy and warmth and compassion is needed in this field when we work as psychologists. Number one. Number two, somehow uh, men are not wanting to come forward in this field, um, basically because there are other lucrative jobs, more so in technology and other areas, in even in the health services, other areas like in nursing profession, more number of women and less number of men. But that parity is changing as of now, and that is the trend that is happening. There is an inhibition because of the way society would perceive. Even when I wanted to do psychology, my family were not so happy that I'm coming into this field. I was mentioning about my daughter and my niece, who are also, not that their families are very glad, but these days we are too strong. We put down our foot, and we are making our own choices. So they don't have much say. Although that kind of a unwillingness from family and society And just a week back, I was meeting a young lady who wants to do psychology. Parents are forcing her to do her MBBS, and she can become a psychiatrist. Why psychologist? So we had in fact, I had done my part to convince the parents, but they are, as of now, not convinced. Still, there is a lot of stigma regarding mental health and mental health professionals, and people are more aware of psychiatrists, and they are more. It's not that they are more acceptable towards psychiatrists and psychologists. It's because lack of awareness. Like I was mentioning in the introduction, even the doctor friends of my husband could not make out who is a clinical psychologist or what is the role of a psychologist. So lack of awareness and stigma, and this is one thing that I've heard over a period of time, especially in the early days of me entering into this field. Like, psychologists, you can read my mind, you know everything about me, and then people will fear and run away. And those who have, some of them who will have problem, have to give them instant answers. They don't understand that there has to be a relationship established, and there has to be mutual trust and understanding and a warmth, and there has to be so much of, it's like, rapport build, and probing deeper and understanding the root cause and dealing with that. uh, I'm facing, even though I'm working with uh, one of the best MNCs in the country, so to say, but there I'm facing a lot of difficulty, because they don't want to come forward. In fact, I would say I'm given a basement room for consultation. So people come hidingly to meet me so that others would not go. Even sometimes I face the manager or the HR would call up and find out if such and such a person has come to you. Is it just for time pass? Or, that's a kind of, it is a very sad scenario. We have long way to go. uh, uh, and I think it is our responsibility as psychologists of our great nation, India, that we have a big role in creating awareness, not just about depression or anxiety or. I'm so glad that independent equity agencies, are coming forward, having this wellness awareness, having wellness companies, hiring a lot of people. So these are all very good sign, welcoming sign as a mental health professional, I would say. And it is very good in the sense that so many people through them are coming um, for reaching out for help. And we need to create mental health awareness in the school. From my part, I'm trying in small ways. And since I'm a trainee also for counseling and guidance, I encourage them, I motivate them to create awareness in their own space. Slowly but steady, it is happening. It's a very encouraging sign in our country. But at the same time, I would say that we have a long way to go.
So we tend to have this sort of things in, especially this discrimination or phobia or about stereotypical thoughts about seeking mental health services is there in rural areas. So I'm finding it new that even companies, corporate companies also have this sort of inhibition when the employees are not able to reach out to, the help is there. They have to just go out there and seek the help, but even the company HRs or some managerial position people, they are not aware of the value of uh, the resource person sitting there in their office, and they are trying to provide a great amount of service to this company and the employees. So this need to be changed, no? Even at the top, I thought that this sort of stuff is available only in rural areas, but it is also available in big corporates also.
Yes.
So there is a lot to change.
Yes, there is a lot to change. My bit, I'm trying my best. Lot of webinars. I would say, when I'm sharing my experience. First time when I did a mental health presentation, uh, nobody attended other than the HR. But thankfully, through slowly the numbers started increasing, and the recent webinar that I've done, around 500 employees all over the country has attended. That's a,
Great, great.
uh great achievement, I would say. So I would encourage each one of you, not to be disappointed and discouraged. The first two presentations, I remember 10 hours I put in working for that, and then nobody turns up. So, but I never gave up, and I continue to persist. That's what my message to the younger psychologists and counselors, that we need to persist. We should not give up, you know. And as we persist, things will move. And who knows, there may be a sudden awakening. And post pandemic, uh, definitely I'm seeing an increase as the increasing number of need for mental health issues are growing. uh, More psychologists and psychiatrists and counselors are needed to deal with the issues. The number of there are around 900 clinical psychologists and 1,800 psychiatrists, 1,500 psychiatric nurses, and 850 odd psychiatric social workers in our country. Uh, if we look at the population, the ratio of mental health professionals available is very less compared to the population that we have, and the crisis that we are facing post pandemic, it is too enormous for few of us to handle. So I would encourage young people to come forward, do psychology. You can be counselors, you can be psychologists, you can be school counselors, organizational counselors, industrial psychologists, clinical psychology, and occupational psychologists. There are, and these days, mass media, entertainment, advocacy, entertainment, sports, all these areas, they are welcoming psychologists, uh, and the need for psychological services per se is increasing. That's good news to all of us.
Good to see that. Good to hear about that. Another question I just want to ask: how do you deal with the clients coming from different socio-economic backgrounds other than your own? Like I come from particular community. I come from particular house. I do have certain standard of living, but I am not
Yeah.
be empathetic towards persons who are not belong to my socio-economic rate or socio-economic levels. So we are living certain bubble, no? We are not fully aware of those people's cultural backgrounds or religious
Yes.
backgrounds and their thought processes. Something that might be looking very normal to us, but that might be very offending to other person. So how do
Yes.
you deal with these different socio-economic cultural background clients? I just wanted to put it in that way.
Yes. See, I believe that as a psychologist, as a counselor, as a clinical psychologist, or as a mental health professional, we need to be culturally sensitive to our clients. It doesn't matter
Yes.
uh, from which background they are coming, which race they are coming. It doesn't matter to us. For us, the
Yes.
first criteria is, here is somebody who is having an emotional need, and this person has come to me, approach me to take help, help, and I should be ready, disregarding all the other factors. At the same time, we have to be conscious of the fact that, uh, you know, sensitive to their culture. A lot of, I would say, a lot of reading is needed to ensure to understand about various cultures and the changing trends. If, uh, as a psychologist, I need to be very careful of being judgmental and critical of my clients, uh, because it doesn't matter who is coming to you. What matters is what you can do to alleviate this person's psychological pain or suffering, or whatever they are, the emotional trauma that they are going through. But being sensitive to their culture is a very important thing. And even to my counseling trainees and clinical psychology trainees, I would always say, for understand that they are an individual first, and the individual comes from a family, comes from a community, comes from a society, and they have their own values and beliefs. There may be certain clashes in my belief and what the client is bringing in, but then but I believe that we need to have the maturity to understand, and once we build a rapport, I believe that all those things should go to the background. And but then, if we don't understand the family background, their community, their culture, we cannot actually provide a service you know in a better way.
Yes.
So understanding is necessary. Yes. What I do, I would
Having
suggest is when
having
I have,
sound cultural sensitivity towards the clients' background is very much important in any session.
yes, yes, yes. I have clients all over the country and even globally. So, for example, one example I would say, I'm not wanting to disclose any other detail, but just the cultural difference that I want to explain. So, I'm using this example. My One of my client, she is a Mexican. So, what a Mexican comes forward, brings forward her culture, her society. So, I had to do little bit of reading and understanding of her culture, and so many things about our culture and their culture is very similar, which made things easy for me with this particular client. But uh, that's not the case with many more. But then being understanding and being supportive, understanding their background and receiving the background without any bias and prejudice, and dealing with the client, minding the fact that this person is more important. There are some clients who would say, they want me to, I have no issues addressing them as madam or sir or anything. I have no issues. But when they keep insisting, I would say, more than what you do, for me, what you are as a person matters a lot. You know, so I've seen that when you give regard for the person, and you value the person's beliefs, you value the person's culture, all that is inclusive comes as a package in therapy. And with that background, keeping those background in our mind when we come forward, it is it is very good, in fact.
Sometimes what happens, ma'am, even therapist or a psychologist or a counselor who is dealing with the client is also human being, and he might be coming up with his own prejudices, and he might be coming up with his own cultural baggage. So sometimes
Yes,
what I have observed in uh, one of the clients example, what I have observed, that a therapist is an atheist and he strongly disagrees the existence of a god or supernatural being. So it's okay
yes,
up to his own liking, or up to his own whatever research background he has gone through it, and he has every right to
yes,
believe in it and he every right to practice it. But he
yes,
cannot be pouring that information, or having all that sort of conceptions about God. He should not be dwelling those things in the therapy. No. So, for example, there is I have seen an example of my fellow therapist. So he doesn't believe in God. So there is this poor lady who believes in God and she prays and he does all puja, all that stuff, and she has come to counseling. And this fellow is trying to explain the things that there is no God, cosmos, moon, sun, all that stuff. So, Bare Baba, you have to pay attention to what her needs are there. No, she might not be feeling well. Her husband has treated badly. So you have to address that interpersonal issue and how to cope with that scenario. But unnecessarily sometimes with the so many prejudices are there in therapist. As an example, I am stating. I doesn't want to reveal
Yes.
that person's name,
Yes.
but
Yes.
he
No.
was trying to give that jnana of there is no God. Look at the moon, sun, cosmos. So it is irrelevant, to the session and to the particular client. So, what do you want to say to those people who are bit very enthusiastic and they have so much of jnana and they want to pour that stuff in their counseling sessions?
Yes. See, we are not. If their religious faith has anything to do with their symptoms or their problems, then it is a different issue. But if see, I'm having a client who's an atheist, but I'm a believer in God. Okay, there is no clash of interest ever happened till date with any of my clients. I bring in a lot of different kind of faith and personal belief. I should not allow that to come into my session and influence somebody's mind. If if it if that is from regarding the client that you have mentioned, it is detrimental for her. It is her personal faith. you know uh, I would definitely discourage uh, people from doing that. It's about respecting, agreeing to disagree. When as a therapist,
Yes.
we have to agree to disagree in many many issues. I have never spoken about God to my clients who are atheists, but there are some clients, for them, I understand their coping strategy is their faith. Then I have to give emphasis for that and use strengthen it. And if that is their coping strategy, I would definitely appreciate that and encourage them to do so. That doesn't mean that I will bring in
People
my
tend to
faith.
forget that spirituality is a great coping strategy. Spirituality
Yes.
can alleviate some persons. So, what if a person is going through very difficult? If the person is believer of a god or some supernatural being, or he has some inclination towards particular thing. So, if we focus on it and if we ponder on it, that he might be that might be very helpful for that particular client. So people tend to
Yes.
forget about these things.
Yes. Yes. It's
I'm
very
going to ask another.
yes.
Ma'am, can you hear me?
Yes, I can hear you. Please go ahead.
I'm going to ask another question.
Yes.
Working with clients who have experienced trauma, and you might have experienced or worked with some client who have been through a great amount of trauma, and how do you have dealt
Yes.
with the extreme amount of trauma? Can you tell me about one example without revealing the situation or the client's name, and how do you help the client, and what was the outcome?
Yes. Presently, I have four clients, young ladies who've gone through complex PTSD or complex traumas. I cannot uh, disclose any of the issues per se. Without that, I would say that right now my passion is to work among young ladies who are going through traumas, and it's all those situations. For example, sexual abuse is becoming very coming forward. Earlier, this was a taboo, and it was never discussed. Now, young women are coming forward, and they are sharing, openly sharing uh, their uh, issues that they have been through. And what I found is, initially, I would be very supportive and very warm and not judgmental. Another technique that I would use is EMDR. It's called eye movement desensitization therapy. and it works wonders with them. And not only that, these clients who would have gone through trauma in life, definitely there is a neurological involvement in that. So the present scenario is the neuroscience is developing fast, and emotional regulation and all that things. We have identified the involvement of brain per se, and different amygdala, cortex, prefrontal cortex, all those involvement. So I am into that as of now. I have done a course from US online, so it's going on, and I would encourage, to do such. And I wanted to be. I believe in continuing education and wanted, to step up to the new changing trends in the field of psychology and in the field of mental health uh, services as well. Uh, so my
Ma'am, can you
experience
elaborate
is that
little bit more about this EMDR and what is this? What is its background and what are all its research? What sort of research has gone into it, and the
yes,
efficacy of EMDR in especially dealing with the trauma and how it's coming to help
yes,
clients who are extremely going through this post-traumatic stress disorders and all that stuff.
yes. Uh, Basically, this is that you're stimulating the brain through eye movement. This is the movement that we do, just moving the fingers, and then you are allowing them to process the trauma. It is very traumatic. The client can become very emotional. You need to be really trained how to do this. Um, so, and then, along with that, we associate self compassion, like the client, consoles herself or comforts herself or himself as they disclose. And during the eye moment processing, they relay the experience that they have gone through. But then gradually, uh, there is a neurochemical change that's happening in the brain, and it gradually, the brain gets desensitized, uh, and gradually the level of trauma comes down. And I have found that it, it's a great mechanism. Not much of research has gone into it, and recently people are taking up this and doing it. Um, but it is very effective and very welcoming sign. Then otherwise you spend a lot of time. Along with this, I also go into a psychodynamic kind of going into the root of the issues of the problem. So I do both hand in hand to deal with the trauma, and then build the support from family members if they are cooperative and understanding and supportive. uh, Building a support system, emotional support system, is also a very important role. But some of the clients will not have a family member or anyone to support them. In that case, I am the support system for them.
Okay. So, especially for a client who has been through this trauma, so sometimes clients might not be willing to recall or go through the trauma once again, whatever session or whatever therapy it might be. So people
Mhm.
tend to they want to suppress or they doesn't want to experience that. They doesn't want to recall that traumatic experience,
Yes,
even though
yes,
they have a chance to get rid of it completely, but they will not be willing to recall those traumatic moments. Na? So how do you deal with those sort of clients?
see, usually what I do is when I come to know about, for example, see the client, most of my clientele are coming to an organization. So, only those who are in such pain and who needs that kind of an intervention are people usually who come to me. But creating awareness is the step, making people through various, now that the social media is there, things have become much more easier for us, creating an awareness that this is an emotional problem and there is an involvement uh, of brain activity, that is the neurochemical activity that is operating in it, and it can be rewired, and you can be helped. That is something, that is our responsibility to create awareness. As we do that, I think it is through social media, through every media that is possible. We need to talk more about this on various platforms, and bring in awareness regarding this. Then I'm sure, and also I would say, even without revealing the identity of the client, if some, for example, Deepika Padukone has come forward saying that she had depression, and that has created a wave, and that has created a lot of awareness. So I hope that there are platforms where people who have gone through this kind of experience are willing to open up and share and create awareness. Not that everybody would do that. At least some of them are doing that, which is very helpful. That more people will be willing, seeing them opening up, at least to come forward and take therapy or counsel.
Yes, yes. Another question I want to address here is that,
Yes.
ma'am, can you share about some of the important concepts like mindfulness and some of the self-care mechanisms that are there in our field? Can you elaborate more on these self-care mechanisms? Like, for example, I'm taking it as a mindfulness. You could have shared any other stuff also.
Yes. Self compassion, is a very important thing. We live for others. It is true that we need to live for others, but many times we neglect ourselves, we neglect our sleep, we neglect our personal care. Our state of well being is important. I believe that human beings are tripartite beings. When I say that, I mean there is a body, there is a mind, and there is a spirit, spiritual aspect to it. And WHO also recommends that, there is a spiritual portion, there is a spiritual aspect to a person. So, if mind alone is worked on, it is not sufficient. If body alone is worked on, it is not sufficient. Spirit alone is worked on, that's not sufficient. So, it is ideally, helping the person to become whole. So, in that aspect, being in the present, self compassion, doing exercise, diet, all those things are very significant, and they play an important role in helping people. I believe that if I cannot love myself, how can I love others around? If I don't care for myself, I cannot, how can I care for others? So what I am suggesting to others, I believe I need to practice this in my own life. I believe that, and I do that. Forgiveness, for example. If I am not able to forgive others, uh, you know, I mean, what kind of therapy that I would do? It is being hypocrite, right? So I believe that, many of the things that we practice, let's learn to walk the talk, which is very important. So one aspect that I would, emphasize upon is coordination between body, mind, and spirit. All the three aspects of a person is important, and the whole approach should be holistic in effect.
Yes. Ma'am, can you share any recent research trends that are happening in psychology field and how they are helping you in your practice?
Yes, I would say telehealth. That's what is happening right now. Uh,
Yes.
Post-pandemic, that is one advancement that is happening. Earlier, I did not have the privilege of reaching out to clients all over the world. Now, the mental health services are very effective and very good. And, I'm able to reach out to uh, more number of clients. Earlier, now it's become much easier for the client to sit at home, switch on the Zoom or Google, and then you are there, and that has made things much easier. When I say this have certain caution, a word of caution, especially when it comes to children. My experience is not so good in therapy and in intervention. The other area that is coming forward is artificial intelligence. We need to make use of. I am also in the process of training myself uh, to get into this artificial intelligence and the technology that is developing. As psychologists, as mental health practitioners, all of us need to be aware of this, and we need to update ourselves uh, because whatever medium is available for us uh, to render the mental health services that we want to do, we should avail it, and we need to upgrade ourselves. Otherwise, we will become redundant and we will not be, uh, I mean, not be valued by the younger generation. I have
No, we
heard
have
clients saying, pardon?
we have to stay relevant to the societal trends also.
Yeah, we will be, irrelevant to the context in which we are working.
Yes.
In the family itself, it's an important thing. If we have an old conservative mindset, that will not work with the youngsters, right?
Yes.
Yeah.
And another issue, ma'am, I just want to address here that you have shared that right now we have this, we can do say therapy, counseling sessions online. But what I have experienced in my limited 5 to 6 years of counseling career, that people tend to have this feeling of human to human connection. They want to have this physical one-on-one counseling therapy sessions. They are not satisfied with the Zoom call or Google call or WhatsApp call. People tend to travel. I have witnessed with my own eyes that they will travel
Yes.
300 years, 150 kilometers. They will travel and come and no, I just want to
Yes.
have a one-on-one
Yes.
conversation with you for just 40 minutes. So there is this, there are two sides also there. People are seeking non-conventional therapy sessions, like they want to have it on WhatsApp call or Google. Some people are that okay, we need to have this traditional form of counseling session that I need to see you. Uh, they will tell us that I don't understand. I'm not able to comprehend why what they're saying. They say that there is this vibration is there, so I could understand that. I can feel that positive vibration coming from you. That I want to have that. They will say that I didn't understand that what they were saying, referring or what. But this sort of people also there. Uh,
Yes. Yes, I fully agree with you. I have a client who says, ma'am, I have to come and see you in person. And
yeah.
there are clients, who would want that. I would definitely welcome them. Sometimes, a therapist is not available in particular area, and especially in rural India. Now that the net connectivity is good, and I'm telling in that context, some of them are very busy, they don't have time, spare time to come travel half an hour, living in the outskirts of the city. So for and people in different cities, they want to connect to somebody, whom they felt with whom, uh, that their therapy would be better if they meet that person. In those situations, definitely I would also prefer, as a psychologist, I want to see. I'm not a very great screen person to say. I would any day prefer to see my client face to face. There's nothing like it. But then, in the absence of a therapist around, that's the second option, you know. And a therapist of your choice may not be available in the city. There are various factors that they are looking for when they look for a therapist, or a therapist of same sex that person is not able to contact. In those circumstances, tele health, mental health services are good, but never a
So
substitute for face to face.
yes, yes. And there are some a little bit drawbacks also there. So as an a therapist or as an counselor, while I'm interacting with a person on screen, so there might be some inhibitions in my mind that okay, this fellow might be recording all this conversation, or
Yes.
somebody might be sitting there in that room, might be listening our conversation that I am able to see only the particular screen, whatever available to me that I'm able to hear or see. But there might be some 20 people might be there, so there will be confidentiality will be gone. Then these sort of things will creep in my mind. So I'm generally saying no. So even I do conduct online sessions, but I have this inhibition that I'm not fully committed. Okay, we cannot give a random example that might be odd to somebody, to the society also. But for the sake of the client, we have to give that example to that person. So what if that person records that example? Okay, somebody might judge us, or somebody might use that for their own purpose or as an evidence or what. So these sort of things are there in that constantly creeping in my mind. So I might be naive in
Yes.
this field, but can you share that? Do you have ever come across this sort of thought that okay, the client might misuse our own content because we are using this technological
See,
platform and yeah,
in
continue,
face
ma'am.
to face session, in face to face session, I've experienced this, that you
Got
know,
it.
since the mobile is there, but never on online. I've never come across any of these issues. I have good number of clients, but people obviously, people, clients who are aware of this facility and how you function, and it depends on the rapport that you build. They trust you and they do not think. But at the same time, I have a caution in saying that when you are in your homes, right now, I am in an interview with you, or I am in a session with a therapist. Uh, like in a webinar, we make sure that nobody is around. I'm in a place where nobody will be disturbed, nobody will be eavesdropping, nobody will be listening. Okay. So here again, confidentiality. I would say they are not coming to your house, but when a client come to my house, my neighbors are all watching, and you know they know that, oh, they are coming to ma'am for a therapy session. So it has both ways. It has its issues, uh, but then it the responsibility falls on the therapist or the counselor, to make sure that uh, this is confidentiality is the prime and the most important thing in a therapy session, like the strategies and techniques and all that we use. So we need to be careful, and we need to own up and take the responsibility to make sure of the confidentiality. I would
Yeah,
say
yeah.
even in face-to-face
I'm
session, uh, yeah, yeah,
the people tend to have this sort of different agendas and different needs, no? So they might use, there is a chance of misusing our own premises, and while doing this marital counseling, also sometimes husband might record what we are saying, and sometimes he might put a mobile phone there and underneath the table, and it might be gone, and might be asking that what my wife has asked or what other person has asked. So they sometimes they might do that stuff, but we tend to say that, oh no, I cannot reveal that stuff. But they use these gadgets, no. Sometimes I came across this stuff what you have referring to. People use recording,
mm,
mobile phone recording, and all that stuff.
mm,
So I was always normally very paranoid and very cautious with these people. So I would be first of all safeguarding my own self. So, okay, therapy is
yeah,
the next thing. First thing is my own priority, no. So I'm always cautious about these things. I'm unaware of these things, how these people
yeah.
use. And I want to ask another
Misuse.
question, ma'am. Misused. Uh, Ma'am, what do you want to say to those people who are still reluctant and hesitant to seek help despite all the assurances and despite the growing necessity and even the awareness campaigns, and they themselves also able to feel that, okay, I'm not feeling well, I want to let it out, I want to vent it somewhere else in a safe atmosphere, but still they are still hesitant to seek therapy help or go to any psychiatrical help. So, what do you want to say to these people?
See, I want to say that you talk to one thing I would suggest, if you have a friend who would have undergone therapy, or if you have a family member, or like there are clients who would call me up and ask and tell me, I've never had this kind of an experience before. What is counseling all about? What is it that you are going to do? I don't know. So then, I would explain to them. And social media, I believe, is one medium that we can use to create this kind of awareness among people. And those who definitely see, first, our system works in such a way, when we have an issue, first thing that we think is, I can sort it out by myself, I can mind my business, I don't want anyone else to come and poke into my business. That kind of an attitude needs to be broken. uh, and generally, we think seeking help is a sign of weakness, which is not true. I would say that we seeking help is an attitude of strength. Shows that you are a strong person. That you identify that you have certain issues and you cannot handle it. Nor your friends or your family members, they cannot handle it. So I would need help of somebody. And that somebody should be some who will keep the confidentiality. Who else other than a mental health professional who can help in that kind of a situation? That affirmation has to come from our side through various medias. We need to send that kind of a message across, so that young people would come forward. But my experience is the younger crowd, student crowd, the adolescent crowd are more willing to come for therapy than the older clients, and that's a very warm welcoming. In fact, I have 4 5 clients, students who have found out my number from somewhere, and then who had called up saying that, I want to bring a friend. And so that kind of it is a very welcoming sign from the younger crowd, that they have, because they are availing all kind of social media. All those are influencing them to a level that they are willing to seek help. I would say, let the elders learn from the young ones, and understand, even as they come forward and do. Definitely, even in the rural population, I understand these days there is an awareness through social media that's happening, and they are coming forward to reach out for psychological help.
And ask last two questions, ma'am. I'm going to conclude this session in a couple of
Yes.
minutes. So, a second question would be, a last second question would be, so there is this, when we compare as a ratio, so there are like 90 percentage of female psychologists, counselors, and therapists are there. Like 10 to 5% we could say that male. So if you go to any workshop related to psychology, there would be like 50 participants are there. 45 would be women, girls, or 3 4 members would be men, and 1 2 members would be like their husband or someone's trainer's son or somebody would be there. So eventually there will be like three or four male participants only. So what is the reason why there are very less number of psychologists, male psychologists in India?
Yeah. Yes, it is very true. It could be because of the general notion again, stigma associated with this profession, and some faulty understanding that females, this profession is more suitable for females than males. That could be one. Second thing is, in a family, I would say it is easier for a girl to get encouragement to go into this profession than a boy. The so-called male society, they want to, uh, you know, uh, uh, don't want to break that cycle because of this male stereotypical understanding of what all professions will fit in a male and which all profession a female will fit in. That kind of a misunderstanding has to be removed. You are a male psychologist. I have uh, many good my male colleagues who are very good psychologists, and it should begin with us. We, you as a male psychologist and the male mental health professional, psychiatric social workers, psychiatrists should encourage other male members to join this profession and how rewarding it is and how important it is also. But the change is trending. As I'm going through LinkedIn, I find that there are a good number of young male, yeah, and smart male psychologists coming up. That's a very good sign, and I feel so glad to see that. But still, we need to encourage others to come in.
So
Every
another
year,
interesting,
yes, yes,
another
yeah,
interesting
carry.
pattern relevant to this question, that men tend to enter into this profession, and when they witness or when they have few experiences with the profession, and when they are able to see that at the end of the day this is a job or profession, that you need
Hmm.
to have proper amount of money in your pocket, or the profession
Exactly.
need. So there is this burden of taking care of your aging parents, wife, kids, or any joint family is there. So they tend to see this. Okay, I'm passionate about this profession. I am okay, satisfied by my profession. I'm learning. There is a great amount of scope is there for learning new things, and all this stuff is well and good, fine. But if it is not paying me enough, if my family is not able to, I'm not able to feed or sufficiently feed number of people in my family or dependent in my family, so they tend to attrition it and they tend to change the profession. I have seen it with on my eyes and experience that men are leaving the profession and taking up some other business or some other job. They want to support the family. So what do you want to say about this concept?
Yes, I fully agree with you. In fact, I was about to tell that then your question came forward. I fully agree with you that there is this uh, issue regarding monetary gain from this profession. In government services, there are opportunities. In private sector, corporate sector, there are opportunities. In private practice, there are opportunities. You know, I believe it depends on how how well you're promoting yourself, advertising yourself, and your networking. That depends on to start off when you are a junior person. I'm sure when I had just entered the profession, I would say that I joined for 2,300 rupees was my first salary, 25 30 years back. But I opted for an organization where I could get trained up well, and when I came out, I started earning more. you know So we need to work out strategies. Yes, of course, I understand that when we there is no parity when it comes to uh, salary for a psychologist or a counselor. Uh, when we look at other mental health, I mean other mental health professionals like psychiatrists, you know, and gradually this trend is changing, and I believe that as days go by, it will change. I think to a great extent it depends on us also, like it is a time taking process. In every profession, when we start off, this financial parity is not there. Gradually, as we establish, with time you grow in your practice, and with time you tend to earn more, and that is also true with our profession. That's what I would say.
I wanted to extend a warm thanks to the ma'am, Manoja Jacob ma'am, for immediately agreeing. I have put this message on LinkedIn whether anyone is ready to collaborate or want to give a small interview, that people like you who are trying to learn new things and people trying to collaborate with the rest of the psychologists of India. So the single only person responded to my message was Manoja ma'am. I would be very indebted for your response and prompt response, and this has given me a great amount of boost. People coming from like rural backgrounds of Telangana like me, and who are trying to do a bit in mental health services, and who are trying to create a little bit amount of brand value for myself, and this would be a great amount of help for me, and as well as people like me who are trying to establish themselves as an counselors or psychologists in this profession. And seriously have taken like some 10 points from your interview that were really helpful for me. And I could say that I am indebted for your time, and I just wanted to say really a big thanks to you, ma'am. And can you give any conclusive remarks to this session?
Yes. Thank you. And any avenues where I can help a co-professional, I'm always available for any activities I would love to be part of. That I am there to support as a senior person uh, about to retire in 2 or 3 years. I would definitely want to encourage all the uh, young psychologists, young counselors, and young mental health professionals, and any avenue that's open, I would like to uh, be there and extend my cooperation with anyone. I also have a message for the audience that more people should come into this field. It's a very noble profession and it's very rewarding. Uh, yes, the monetary involvement, of course, it is a factor, but then I would say once you will establish your practice, you will earn well. We have to prove our metal anywhere in any profession, and then we will earn well. But this is a wonderful, wonderful profession where we can serve humanity and help people who are going through emotional pain. Lot of professionals available to alleviate the physical pain, but when it comes to mental health, there are only very few of them in this country, but the need is so much. No, that's what I would like to say.
Thank you, ma'am. Thanks for the time, and thanks for the people who are going to watch this video. And let's see that we're going to come up with so many other interview sessions with renowned psychologists of all over India, not only from South India. We're going to search and we're going to find a great amount of talent is there, great amount of knowledge is there. We're going to come up with all interviews, and we're going to share what they are practicing and what are the best practices they are there, and the information that we're going to put there, is hope going to be very valuable for the young psychologists like me. They can there is a great amount of stuff to learn and grow our careers. As my regular saying is goes like this: take care of your families, take care of yourself, stay strong, stay safe. Have a nice day. Namaste.